Good afternoon, everyone. My name is Alexa Hawley, and I am the event specialist for Care Compass. Welcome to today's town hall. The title is Waiver Readiness Funds Update, Waiver Workforce Initiatives, and the response to submitted questions. I will turn it over to Lisa Berard, Director of Open Network at this point. And just to let everyone know, the session is being recorded. So if at any point you have to hop off, the recording will be uploaded to our Care Compass website. And feel free to drop any questions you may have at the chat in the chat box or Q&A box at any point throughout today's session. Thanks so much.
Thanks, Alexa. We can go to the next slide. So we'll kick off today with a very brief update. As you recall, our board of directors made available $3 million in total funds to support waiver readiness of organizations serving individuals within the original state-defined region for the DSRIP opportunity. So of those funds, the projected budgets that were submitted, 48% of the funds have been allocated or anticipated to be allocated to HR and staffing, nearly 26% to waiver readiness, and almost 25% for infrastructure improvements, with 2% for additional purposes. From the information submitted, over 350,000 duplicated, so not unique, estimated Medicaid members were served in 2023, and 123,000 social care screenings were provided in that same time frame. So at this point, the final awards are still being calculated, but all payments are expected to be made by March 28th. So very quick turnaround on that. Next slide. So now we'll move right into the waiver workforce initiatives. And the waiver includes two specific workforce initiatives. The first is a student loan repayment for qualified providers, and the second is a career pathways training, CPT, otherwise known as, programs. And the purpose of these, according to New York State, is to support workforce recruitment and retention and basically improve availability of healthcare access to the Medicaid members and the demonstration beneficiaries. Next. So diving a little deeper into the first opportunity, the student loan repayment for qualified providers. Qualified providers are defined as psychiatrists, primary care physicians and dentists, nurse practitioners, and pediatric clinical nurse specialists. So the cap for psychiatrists is $300,000 per provider. For primary care physicians, it's $100,000. And for nurse practitioners and nurse specialists, up to $50,000 per provider. And recipients of these loan repayments must make a commitment of full years of full-time employment, maintaining either a personal practice panel or working at an organization that maintains a panel inclusive of at least 30% Medicaid and or uninsured members. Next slide. So the second opportunity is the Career Pathways Training Program. And this is designed to help build up the allied health and healthcare workforce. The focus is on career advancement for individuals that are in entry-level or lesser skilled roles, and also for unemployed individuals. And this is being organized into 3 regions for statewide implementation. So it's divided into 2 basic career pipelines. The first is the Healthcare Career Advancement Pipeline. And these are for individuals who are currently employed at a New York healthcare provider. This does require the stipulation of a 3-year commitment of service under the new professional title that's achieved through the training program. And it must be with a Medicaid enrolled provider that, again, serves at least 30% Medicaid members or uninsured individuals. And the second pipeline is for new careers in healthcare. And these are for participants who are either unemployed or not currently employed by a New York healthcare provider. This also requires a 3-year commitment of service with a Medicaid provider that serves, again, at least 30% Medicaid members or uninsured individuals. So the available professional education programs under the CPT are 3 broad categories of nursing, professional technical titles, and frontline public health workers. So the training programs do have to be certified or accredited by the state or organizations that the state recognizes. So under nursing, we have licensed practical nurse, associated registered nurse, a registered nurse moving to a bachelor nurse, or nurse practitioner. And professional technical titles consist of physician assistant, a licensed medical health counselor, MSW, credentialed alcoholism and substance abuse counselor, a certified pharmacy technician, a certified medical assistant, a respiratory therapist. And for frontline public health workers, there are community health workers, and on my screen, I can't quite see it, but I believe it's care managers. Next slide, Alexa. So this whole program will be managed by Workforce Investment Organization, or fondly known as the WIOs. So New York State will contract with these workforce investment organizations. There's over $645 million dedicated to the programs. They will be selected through an application process. We're hearing that those selections may have been made, but there's been no official announcement, so we won't make any speculation at this point. The WIOs are expected to establish partnerships and work with the training and education institutions, the health systems, and the CPT participants. They will be responsible for coordinating the training and education opportunities, providing support to participants to assure successful program completion, and then finally to support job placement so individuals are able to meet the required service commitments. Next slide. Are there any questions at this point on the workforce initiatives? Okay. Then we'll move right into the question and answer responses from the New York State Department of Health. They released them on February 20th. It was a 52-page document comprising over 295 responses. The responses that we include today, thankfully, are only relative to those that were submitted by Care Compass Network and participating organizations. I would like to point out 2 disclaimers that the state included right at the start of the document. The first is that in the event that there's any conflict between the RFA information and the responses to the Q&A responses will prevail. That said, New York State is not responsible for any errors or misinterpretation of any questions that they received. So make of that what you will. Next slide. So first question, if a Medicaid member is attributed to a social care network lead in one region, but receives a referral and HRSN services in a different region, which SCN is responsible for reimbursement to that CBO? The state's response, the social care network is assigned based on the person's address. The social care network program manual will provide additional information on regional crossover, but it is not pertinent to formulating an application response. Next question. If a patient moves out of the service area, what will be the process to have that change applied in a timely manner? So the ongoing issue of attribution is what this question is addressing. And what is the frequency or process that DOH will utilize to update and assess the attribution throughout the waiver? The state's response, if someone moves out of one SCN service area and into another, the SCNs will coordinate. MCOs will be required to share a routine roster to the SCNs. The member roster will identify those who reside in the SCN region and any associated change in residence. Next question. How do you define community advocate as referenced in the governance requirement on page 11 of the RFA? So this is a section of the RFA that was listing the required representatives that must comprise the governing body of the social care network. And the state's response is This would be an individual or organization that has a vested interest in a neighborhood or community and advocates for vulnerable populations within that community. Next question. What is the state's plan to expedite the social care network leads access to Medicaid claims data? This data is essential for the social care network to understand the need for health-related social services and collaborate within the healthcare ecosystem to deliver on the waiver's stated objectives. And the state's response is the department will provide claims-based information in the form of NYHER member eligibility rosters sent from the MCOs to the social care network. What measure does the Office of Health Insurance Programs, or OHIP, plan to implement to ensure that MCOs are held accountable and act in accordance with DOH's vision for the waiver, which requires meaningful collaboration with SCNs? The department will have requirements of the funding, including the PM calculations and payments to the SCN. So they will be establishing those requirements for the MCOs. Next question. When are awarded infrastructure funds planned to be distributed by the state? Implementation milestone due dates are based on contract award and disbursement of funds. And the state's response is that funds associated with the RFA will begin upon execution of the contract. And to put that into context, the contract term is stated to begin August 1st of 2024. Next slide. So beyond the overall standard terms and conditions of the waiver, will the state provide model contracts to maximize standardization across the regions? If not, what are the plans for ensuring standardization of contracts with plans across the regions? And similarly, how does the state envision standardization of contracts between the social care networks and CBOs, particularly for CBOs serving multiple regions? The state's response is that the department will provide templates and guidance to standardize and require contracting between the MCOs and SCNs, and that ultimately each social care network will be responsible for establishing contracts with the CBOs. Will Medicaid members be able to receive HRSN navigation and HRSN case management at the same time as other forms of billable case management, such as health homes? If not, what is the role of the social care network in ensuring case management services are not duplicated? And I'll just make a note that this question was included twice in the state responses, so it'll be addressed again in the following slide. But the first response is awarded social care networks will provide care management related to HRSNs only, and will not provide any clinical case management. If a member is receiving a funded form of HRSN related case management, the social care network will not be able to provide case management to that member. Next slide. The second response to that same question, during an assessment, the social care network will confirm the Medicaid member's eligibility, choice of service, and avoid duplication of service by confirming what services the member is currently engaged with prior to referring to other services, such as clinical case management and health homes. Eligible Medicaid managed care members can receive screening, navigation, and HRSN services, and these include care management, which is not clinical in nature, but can be utilized to connect members to existing services, coordination of services with other providers, and generating a detailed care plan in which the appropriate and agreed upon CBOs providers may access notes for care coordination purposes. So it really comes down to being careful in your assessment and evaluation of the member's eligibility and understanding exactly what services they are already receiving at the time of the assessment. Next slide. We are wondering how the billing for peer services that are already available within OASIS billing will change with the waiver. The response, the social care network cannot fund existing Medicaid billable services or those funded under local, state, and federal programming. So anything that's currently being billed within OASIS or any other state and federal program will not fall under the social care network functions. Next slide, thank you. Where does the payment for screening and navigation of Medicaid fee-for-service members funding come from? And who or where will the social care network submit claims for the fee-for-service population? The SCN will submit claims for fee-for-service through eMedNY. The social care network will receive payment based on that fee-for-service claim and will subsequently pay the entity within the network that provided the screening and navigation. CBOs themselves will not be billing or submitting claims through eMedNY. That will be solely the function of the social care network. Next slide. Does the social care network data IT platform have to be an all-encompassing platform, or can it be a combination of integrated systems? For example, separate vendors for listed technologies such as the closed-loop functionality, billing, and social care human resources. The state's response is that the data IT platform can be a combination of disparate systems if they are seamlessly integrated and managed centrally by the social care network. The social care network will be required to fulfill the requirements of Section E data and IT infrastructure. Ideally, each social care network will have a comprehensive platform that meets all the required functions. Next slide. So when will we learn more about the privacy, security, and compliance requirements of CBOs contracted with the social care network to deliver the HRSN services? For example, HIPAA, exclusions, insurance. Ideally, we would like this available before the submission of the infrastructure budget. It doesn't look like that's going to happen. The response is that eligible CBOs that enter contracts with the SCNs will be provided licensed access to the IT platform. And it will be that platform that's designed to manage all HIPAA, security, and privacy and data sharing requirements. So there was also a statement that not every CBO will require access to all health-related information, and that platform will be designed to manage who is able to see what information. And all other specific privacy, security, compliance, and data sharing expectations will be outlined in the contracts between the CBOs and the social care networks. Next slide. Beyond screening and referrals, are healthcare providers and health systems who provide HRSN services in the community permitted to provide the HRSN enhanced services? Will healthcare providers be expected or allowed to contract with the social care networks? And if so, for what purpose? So to use waiver funding for screening and HRSN services, hospitals will need to contract with social care networks, and they will need to utilize the required structure of the waiver, which means that the healthcare providers will only receive payment if they are contracted with a social care network and connected to that social care network's IT platform system. The state further indicates that multiple types of entities are allowed to provide screening and services within a social care network. However, for the purposes of this waiver, the participation of 501c3 CBOs is emphasized and given priority to ensure small nonprofits are able to participate in the networks. Further information elaborated a bit more in that if there are gaps in care that the CBOs, as the state defined, are not able to fulfill, that's when other organizations can be brought into the social care network to help fulfill those gaps. Next slide. When will the social care network program manual be released? And when will the enhanced services fee schedule be released? The department will provide the social care network program manual to awardees at the time of contract execution. In a separate response they indicated prior to the contracting start date. So the contract term is intended to begin on August 1st of 2024. The applications are due on April 5th. So sometime between those two dates, we will be receiving the program manual. And that program manual will also provide the rates. The rates will also be made publicly available, and they're not needed to respond to the application. Next slide. At what cadence will payments be made by DOH to payers? What cadence will the PMPM payments be made to payers? To the social care networks. Additional information will be provided in the Social Care Network Program Manual. These next several questions have basically that standard response. So also in the program manual will be the methodologies that DOH will utilize to assess the return on investment of deploying these social care services compared to the overall impact on total care. Next. And then there was a final question. Can you provide clarification on the many dates associated with this waiver? And it does get a bit confusing as you read through the waiver. But basically, the current New York Medicaid redesign demonstration approval period began April 1st of 2022 and will terminate on March 31st of 2027. Because CMS and New York State took quite a long time in negotiating this amendment to that waiver, the amendment doesn't take place until the start of the third year of the demonstration period. So the final 3 years will be included in this amendment. Demonstration year 1 will begin April 1st of this year. Demonstration year 2, April 1st of 2025, and the final year on April 1st of 2026. So it's a very short turnaround to get the program up and running so that we can make the greatest impact possible over the next 3 years. And that is the information that we had to present today. Are there any questions, any further follow-up questions? I know some of the state responses were not as detailed or informative as we would have liked them to be. We're all eagerly anticipating the release of the program manual. I feel like it'll be on the New York Times bestseller list immediately. And are there any questions in general relative to the funding opportunity, relative to the workforce investment information?
I'm quite sure I'm going to have some questions, but I need to think. This was a lot to take in. So I did copy down your email, and this is coming from a worker's standpoint. Okay?
Mm-hmm.
Thank you.
Of course, it is a lot of information to digest, and this was only a small portion of the entire document providing the state responses, which if there's interest, we can certainly share with you all. There's a wealth of information in there, but for the sake of time and not boring you all to death, we only focused on the questions that were submitted by our member organizations on behalf of them and the questions that we ourselves had for the state. If you have the time and desire, some of the responses do give a little glimpse into what the state might be intending for that program manual. But again, there's nothing solidly definitive. There's a lot of information that will be coming out in that program manual. Okay, well, please feel free to submit any questions that crop up. I know it was a lot to take in a brief period of time, and we will do our best to find those answers and be responsive to that. And we'll share the information that the state provided in its entirety. I personally have found it a little tricky sometimes to actually get to where the state is making it available through the grants gateway. So happy to share it for ease of your convenience. Brianna?
Can you hear me?
I can now.
Excellent. I hope that this question.
Brianna, we can't hear you any longer if you're speaking.
Really freaking out about me trying to interact with you guys. So, here, now I'm on. Anyway, so can you hear me now?
I can, yes.
Excellent, thank you. I just wanted to confirm that the funding for the career pathways training, so that's also filtering through the social care networks, or does that like go directly to the organizations who are employing?
So all of the funds relative to the workforce investment are being managed by the workforce investment organizations, of which there will be 3. The state has just allocated 3 different regions to manage that money.
Do we know what those organizations are?
There are only rumors, so I would prefer not to speculate.
No problem.
But we looked to see if anything official has been announced, and we're not yet seeing anything, but hopefully shortly, because usually the announcements follow not too long after the rumors.
Okay, perfect. And I trust that you all will keep us informed when that information is available.
Yes, 100%.
Thank you so much for the updates and your patience with my technical issues here.
No problem. Okay. Not seeing any further questions at this point in time, we'll conclude today's meeting and hopefully see you all again soon.